All right, good afternoon, everybody. So I'm Dr. Kartono, I'm Francisca Kartono, dermatologist based in the US. And this afternoon, we are going to talk about synergy in using our devices. Thank you, Aerolase, for having us here at the IMCAS meeting. And today we're going to talk about a protocol, too, that Aerolase has developed called the Reverse protocol. And it requires the use of both of our lasers, our 1064 laser, 650 microsecond, but as well as the ERA, which is our erbium laser, 2940 nanometers and 300 microseconds. So we have our patient ready to go here, but let me start first in terms of why do we need the synergistic model and when would it be useful? So it's been a while that we have lasers around to help us in rejuvenation and aesthetic techniques, but like anybody knows, we want to work smarter and not necessarily work harder. So having multiple modalities that we can implement at the same time saves the patient time, but also more importantly is achieves the results that we want even better. So I call that synergism, where one modality alone helps, a second modality helps too, but when you combine them, oftentimes you can actually achieve more. It's kind of like a parallel trend we see in everything these days. And so I'll start off with the foundation of it all first. So the foundation device that we have is our Aerolase 1064 nanometer, 650 microsecond laser. That's our Neo Elite, and so our Aerolase Neo. And we'll start with that because we talked about this device yesterday already, and we talked about 1064 being a classic wavelength that we know about in dermatology. Its main chromophores, melanin, hemoglobin. But today we're going to make use as well of another aspect of the 1064 nanometer wavelength. Because it can penetrate deep, it actually has an effect to heat up deeper in the dermis. So dermal remodeling. Because it's a 1064, it saves your epidermis from getting damaged, especially in skin of color. We know that 1064 is the key wavelength you want if you have patients with skin of color. As you bypass the superficial wavelength, you can heat up in dermal packets in the dermis and allow for what's called neocollagenesis, or a non-ablative dermal remodeling process. On top of that, you also have the benefit that melanin sits in the superficial hair follicles as well. And so we can treat pseudofolliculitis barbae, we can treat hair follicles that are unwanted. Its second chromophore, which is hemoglobin, sits in the veins and also in superficial blood vessels. But unlike the traditional vascular lasers in the 500 wavelength, the 1064 allows us to get deeper in the skin and be safer so that the heat isn't packed in the superficial skin. So risk for PIH, risk for post-inflammatory hyperpigmentation is less than compared with our vascular lasers. So I think the synergism even just solely in the 1064 nanometer laser exists already by being able to treat our reds, our browns, and then deeper in the dermis to result in the recruitment of more collagen over time. It's what I call in our clinic, in my personal clinic, I call it the lunchtime procedure. So you can come in, get it done, repeatedly do it every 2 weeks to every 4 weeks. And oftentimes we prep the patient's skin because most of my patients require maintenance treatments like this, where we recruit the collagen to strengthen the dermis. It's cause a tightening effect on the skin. But when they're ready, after 2 sessions, 3 sessions of the Neo, they might be ready for something more high impact. And so that's when we talk about the next laser. But before I go into that, you might wonder too, well, where's the evidence? Is there actually evidence that the 1064 nanometer laser can actually recruit the collagen? And the answer is yes, because there's multiple studies already, whether it's by using punch biopsies to show increased collagen expression in the dermis. That has been done, whether on its own or in combination. There's also a variety of lasers now in combination with injectables that are showing signs to reduce inflammation, as well as creating a more synergistic overall outlook, or the global analysis looks improved. But then we're in the age where molecular markers might be able to help us actually to show us a reduction in inflammatory markers, perhaps. So let's talk about the second part of it. Let's say the foundation has been done, patient's ready for something with a little bit more downtime. If you look at the skin, we've been working on the deeper dermal component And with the Era, which is a 2940 nanometer laser, in comes a superficial way to do controlled ablative treatment on the skin. So the Era is our 2940 nanometer laser with 300 microsecond pulse width, and is able to create like a 5 to 10 micron effect of micropeeling. Very controlled, downtime of about 7 days, and oftentimes no numbing is needed. So I have my patients do an ablative process without any numbing on the surface of the skin. If you do need numbing, I numb for 15 to 20 minutes or so with topical lidocaine, and patients do very well. And so I think eventually when you look at the whole treatment combo, you're treating the skin from top to bottom, or bottom to top, depending on your sequence. But you're able to target a variety of needs in our patient, all with minimal downtime and able to achieve the outcome that we want. Because most of our patients don't want one modality and push it to the extreme. Many patients want gradual improvement in terms of their skin, which we can get with the Neo. And then when needed, we can go a bit more stronger and go ablative on the surface. At 5 to 10 microns per pass, you can hit about 50 to 100 microns if you go aggressive with the Era, still with minimal pain, and a recovery in 7 days. In terms of results that we can get with it, so in terms of the ablative focal micropeel effect results, you're able to achieve improvement in terms of wrinkling, fine lines all get improved. And if there's superficial pigmentary alterations too, those would get evened out with the use of the Era. And so together, by ablating the surface as well as causing tightening and heat and dermal remodeling in the deeper dermis, you're able to attack the skin on all angles. And so then you might ask, where's the proof? So there are actually publications that look at singularly these two wavelengths, the 1064 nanometer on its own, as well as 2940 nanometer on its own. However, when combined, you do see that the improvement when scored are actually synergistically much better when combined, done on the same day, than each individual wavelength treatment on its own. So that's what we're taking advantage of with having the two wavelengths available. And its microsecond pulse width duration with Aerolase makes it particularly special because it allows for a lesser downtime on both aspects with the Neo as well as with the Era. And thank you for your time.